Well, it's an interesting term that I actually am still struggling with. I think fundamentally it talks to this reality that we face in that we are treating patients with these complex diseases, and I'll restrict my comments to inflammatory bowel disease, but I think it's true for a lot of these diseases, that we really don't understand what causes the disease, and we don't fully understand the pathogenesis of the disease. So we are, in a sense, guessing at how to treat these patients. Now, sometimes our guessing is very good, and sometimes there is some basis to it, but I think it is very clear that if you take 100 patients with a given disease, they probably respond or react in 100 different ways. So the notion that we need to get a little more clever in how we divide, understand, and therefore choose treatments for these patients, I think is the real challenge going forward. And the idea of precision medicine is exactly that, being able to understand each individual and how they are different so that we can be more effective in our treatment choices. Well, my own research is in fact looking at trying to understand the fundamental basis for disease. And of course, you start with the disease cohort, which which again is a very heterogeneous collection of people. And you try and model that, and then you try and go back to the patients and see how well your modeling attributes a proportion of your patients. And at the end of the day, if we have biomarkers or if we have genetic markers that distinguish patients who will respond to treatment A versus treatment B, then that's how you will begin to apply the concept of precision medicine to each individual patient. I think there's potential for seeing very major changes. One is in terms of the numbers of treatments that we may have as options. Number two is how those treatments will be implemented and their cost. And then, of course, in dealing with patients and their preferences in terms of benefit versus risk, dealing with physicians' biases in terms of how to treat, and dealing with the payers who are going to be left with the bill for what may be very expensive treatments, I think is really our challenge. And I'm not sure how that's going to look in 10 years, but I think it'll be very different from the way we practice medicine today.